So what is active surveillance? We know historically that we've likely overtreated prostate cancer. And by that I mean in roughly 20 to 30% of men who've had treatment for localized prostate cancer, such as radiation therapy or radical prostatectomy, that cancer may never have advanced in that patient or killed them. Yet, that's the only treatment option we've had. And so in essence, we've cured them, but perhaps we've impaired their quality of life in reaching that cure. Active surveillance is becoming more popular in treating men whose prostate cancer is very low risk. And by that I mean a Gleason score of 5 or 6, a PSA that's less than 10, and cancer that is not large, meaning less than 3 cores out of 12 contain cancer, and no more than 50% of an entire core contains cancer. These are men who are probably at low risk of this cancer spreading or taking away their life. In these men, active surveillance is used to carefully monitor the disease. And by careful monitoring, I mean checking a PSA at least every 6 months, and then performing a repeat biopsy at 12 to 18 months after the original biopsy. What we look for then is progression of the cancer. If the PSA remains stable, and on repeat biopsy there is still only a small focus of cancer in less than 3 cores, then we can continue watching them. If, however, there is progression of the disease, meaning there is a sharp rise in the PSA, or it becomes more prevalent in more than 3 cores, or the cancer grade increases to a 7 or higher, then the cancer is likely still localized, and we can initiate treatment at that time. Active surveillance has become quite popular now with a lot of urologists, and in my opinion, has an important role in treating localized prostate cancer.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed, but right now a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.